Carol Ann will take your phone calls, and she'll even check out your photos on her In the Garden Facebook page. Grab a tall glass of something refreshing and spend an hour in the garden with Carol Ann each Tuesday morning, right here on The Source, WOCA.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 25 minutes before 12 o'clock. Thank you for tuning in. Do not ever trust popular culture to teach you about things.
Okay.
Like songs and movies and things like that. The word schizophrenia, do you know what it means?
Yeah, I do. It's your opposite of what personality you are.
Okay. See, I sort of heard that it was like multiple personalities.
Oh,
and I
okay.
think I got that from like TV or movies or something.
Uh-huh.
But when you look at the notes for this next interview, it's not exactly true. So let's find out what is true. Dr. John M. Kane is on the phone. He's a renowned psychiatrist. He's the Senior Vice President for Behavioral Health Services of Northwell Health, and he's the chairman of the psychiatry at the Zucker Hillside Hospital. And Maye is on the phone. Maye is a passionate caregiver whose adult son is living with schizophrenia. Maye is also a retired counselor herself and a mental health advocate. So we're talking about advocating for better understanding and patient care in schizophrenia. And again, I feel like popular culture does a disservice in trying to help us understand some of these things. And I think this is one of those examples. Dr. Kane and Maye, good morning to both of you.
Good morning.
Where are you both? Where are you calling from?
New York City.
Are you both in the same room?
Yes.
Oh, okay. Well, thank you for being on the air with us. So, Maye, how old is your son?
My son is now 38.
38. And was the schizophrenia diagnosed early on in his life when he was younger?
Yes, Jason was diagnosed when he was a young adult. I remember that was a very confusing time for us because we were trying to understand Jason's symptoms. We were also trying to work with his doctors to come up with a good treatment plan for Jason. But we were also going through a lot of trial and error because the problem for Jason was that he kept forgetting to take his medication.
And what were the symptoms? What was it? What was he showing? I hate to bring up the cultural thing, but we are told it's a multiple personality thing. Was that something you noticed?
No, I didn't notice that Jason had multiple personalities, but we did at that time have to have an army of helpers. Someone had told me that, used that phrase with me, and so we used a lot of different resources to learn as much as we could about schizophrenia, and so that we would be able to help Jason and his doctors to come up with a plan for treatment that would work well for Jason.
So that was some time ago, since he's now 30-something, you said? So,
yes.
For the next question, Dr. Kane, has the profession that you're in evolved to the point where whatever she was going through back then is different now? Would there be a different treatment nowadays compared to back then?
Well, I think there are some differences in treatment, but Larry, first let me clarify what schizophrenia is.
Yes,
it's
thank
really
you.
quite different from multiple personality. That's a common misperception.
Okay.
Schizophrenia is a problem in the way the brain develops. It affects about 1% of the population. So in the United States, we're talking about almost 2.5 million adults living with schizophrenia. In Florida alone, 185,000 adults living with schizophrenia. It's an illness that usually manifests itself in young adulthood, but it causes things like hallucinations, hearing a voice when no one is speaking, or voices that other people are not hearing, or what we call delusions, which are fixed false beliefs. So, for example, if I'm convinced that people are plotting against me, or I'm convinced that I'm getting special messages from the television, those would be the kinds of symptoms that we would see in schizophrenia. In addition, people have sometimes difficulty socializing, difficulty communicating in an understandable fashion, difficulty attending to things and planning. So it can have a very difficult impact on the ability to work or to go to school or to socialize. And it creates a tremendous challenge not only for the patient, but as Maye said, for the family as well. And even though this is a potentially serious condition. Of course, with any illness, we can have mild cases or more severe cases. We do have treatments that can be very helpful. So we recommend coordinated care so that the patient and family have access to counseling, to supportive employment, supportive education, helping people get back to work or back to school. But also medication is a critical ingredient in the treatment of most patients with schizophrenia. And of course, medicines have benefits and risks, and patients and families should discuss with their healthcare provider what those benefits and risks are. But if the decision is made to prescribe medication, then we want to make sure that the patient is able to garner the benefits that the medicine can provide. And that means helping them actually get the medicine. So when people are taking oral medicine every day, it can really be a challenge. As Maye said, her son was having trouble remembering to take medicine every day.
Mm-hmm. Yeah.
Can this be misdiagnosed as bipolar?
Yes, it can. That's not unusual, and it's very important that the diagnostic process continue. So we need to make an initial diagnosis, but then follow the patient very carefully to make sure that the diagnosis is correct. And if it's necessary, we might have to change the diagnosis. It's not always clear during the very early stages, but it's very important for the patient and family to learn about the illness, to understand what the consequences are, what the appropriate treatments are, and then it's our responsibility to help the patient and family have access to appropriate treatment. So Maye and I have partnered with Janssen Pharmaceutical to increase the awareness about one of the important options, which is the long-acting injectable formulations of medication. So instead of taking pills every day, one can receive a long-acting injection, and that way we know, and the family knows, that the patient is getting the benefit of the medicine, and that can go a long way towards delaying relapse or rehospitalization, because when that happens, that can really interfere with someone's path towards recovery.
Wow.
Maye, when your son does not have his medication, does depression play a role? Is he depressed when he's, like if he forgets his medicine, that kind of thing?
That can happen sometimes for my son, but consulting with Jason's doctors and coming up with a treatment plan that would work for him was the most important part of Jason's treatment. About 10 years into his treatment, we were introduced to the idea of a monthly injectable. And this was really important because up to that point, Jason had probably had about 5 relapses and had been hospitalized 3 different times. And then the idea of taking a monthly injection as opposed to taking a pill every day was introduced as a possibility. And that has worked very well for Jason because he doesn't have to remember. And I was making a phone call every day to Jason to ask him, did you remember to take your pill? And sometimes the answer was, well, I don't remember if I took it or not. And sometimes he might say, well, maybe I think I took it this morning, but I'm not sure.
Oh, wow.
So when he began to get this monthly injection, his treatment plan was fixed. That seems to have worked the best. He has had the most success on this plan, and we've seen some positive hope.
Doctor, the fact that there is a medication that can make a difference, that to me, I'm just a layperson, just a radio guy, but it sounds like that means that it's physical that appears mental. Is that right?
Yes, we believe that this is a problem in the way the brain develops, and it's largely genetic. It's a complicated illness, but we know that the medicines can be very helpful in controlling the symptoms and also in delaying relapse. And sometimes you asked about the early signs of relapse. It could be depression, but it's often things like fearfulness and anxiety and withdrawal and difficulty sleeping. And so we need to be on the lookout for those things. But again, taking medicine is a challenge for anybody. And if we have a way to provide medicine that is more reliable, that's very valuable for us.
And when a person turns 18 and they're growing up that they are an adult, your son is now 38, you said, I mean, you want to be your own person and be self-dependent. You don't want to depend on your parents calling you every day, micromanaging your life. So this is perfect for that.
You're so right. That is a very good point. He is an adult, and of course he doesn't want me reminding him of these things. That borders on nagging, and who wants to be nagged by their mother? So and I think it gives him control over his treatment. He knows that this is what he has to do every month. And I think that you brought up a very, very interesting and a really good point.
Dr. Kane and Maye, thank you both for taking time to do this and sharing the stories and a direction for people to go. Is the way to find out more information through the website?
Yeah, the website is the nationalcouncil.org/LAMS, and that does provide useful information about long-acting injectable medicine, and we recommend that as a resource.
Okay, very good. Dr. Kane and Maye, thank you both.
Thank you.
You're welcome. All right, we'll be right back.
Two Men in a Truck believes every veteran should be recognized on Veterans Day. That's why Movers for Military is teaming up with WOCA to collect essential items to be delivered this Veterans Day to veterans being assisted by Veterans Helping Veterans USA. To donate items, drop them off at the WOCA studios Monday through Friday, 8 a.m. to 3 p.m. to help in aiding veterans and their families in crisis. This announcement has been brought to you by your friends at WOCA News Talk, The Source.
With a graduate degree in management and leadership from Webster University, there'll never be a better time for you to explore what's next in your career. Classes are scheduled so you can continue your normal workday routine, and the accelerated program means a new term starts about every 10 weeks. If you're looking to gain a broad general management and leadership perspective, then Webster University's management and leadership degree